Hi, I'm Meg Moore, a BCBA and the clinical trainer at Hopebridge. Today, we'll be answering some common questions that we get from early career BCBAs. In my experience as a clinical trainer, I've been fortunate to work with hundreds of BCBAs. Whether you are early in your career or a few years into your role, chances are you still have questions. Let's talk through some of those questions now. What types of training should newer BCBAs look for when seeking a new job? I would encourage BCBAs to seek learning opportunities that focus on utilizing compassionate practices to make socially significant changes in the lives of their clients. Specific topics include empowering caregivers through meaningful caregiver guidance sessions, how to be an effective and ethical BCBA supervisor to a team of RBTs, and how to write individualized plans of care. How can early career BCBAs find support when they have questions? At Hopebridge, we have a really robust clinical support system and freely accessible mentors. From our directors of ABA to our quality team, to our regional team, to me, our clinical trainer, we are all very accessible to our BCBAs. We've also created a BCBA hub online where we vet and store resources for our clinicians. Outside of Hopebridge, BCBAs can access the ABA Ethics Hotline for ethics guidance and support. I also encourage BCBAs to ensure that they're fully utilizing the BACB portal. Through this portal, BCBAs have access to newsletters, to the ABA Ethics Code, as well as free scholarly journal articles. How does the Bridge program at Hopebridge facilitate professional growth and development? Sometimes training in our field can be a little elusive in the sense that it provides the why or that we should be doing something, but not always a clear how. The Bridge program was designed so that BCBAs can take actionable items, examples, and resources directly back to their center and utilize them with their caseload. Additionally, the Bridge program is broken up into two parts. In the first half of the program, BCBAs receive training on topics that we have decided are needed for early career BCBAs, such as family guidance, individualized plans of care, and compassionate care, like I mentioned earlier. In the second half of the program, BCBAs can use their professional development stipend to attend CEs of their choosing and that align with their professional interests and the needs of their caseload. And in both halves of the program, BCBAs are earning free CEUs towards their recertification. It's also important to note that passing the BCBA exam is just the beginning of one's learning and growth journey. And it's also when they take on their first caseload without really knowing how to do so. The Bridge program is unique in that it provides a comprehensive avenue of learning and growth for our science that BCBAs can immediately implement wherever they are in their career. What opportunities for career development exist for BCBAs at Hopebridge? There are a lot of different ways that BCBAs can get involved and grow at Hopebridge, and there's really something for all types of interests. BCBAs have the opportunity to serve on our DE&I and fellowship committees, and they can also grow in their practical functional assessment skills. BCBAs can also progress through a variety of roles through our Career Pathways program, such as Lead BCBA, Senior BCBA, and more. What would you tell your younger self as you were becoming a BCBA? It's okay to say, I don't know. It's also okay to learn something new that changes the way you program as a BCBA. That doesn't mean you were wrong before, it just means that you're on your own journey of learning and growth, as all clinicians should be. BCBAs should keep in mind and aim to have agility in their thinking. And when new data emerge and show us better or more compassionate ways to implement our science, we reserve the right to change our opinion and the way that we implement. And that should be celebrated and respected. Lastly, I would tell myself not to get so boxed in with behavior analytic literature and to expand my reading into other empirically validated sciences that can also contribute to our science and the way that we implement it. At Hopebridge, we want to ensure that our clinicians have as many opportunities for growth and support as possible, no matter where they are in their career path. If you would like to learn more about advancement in your BCBA career, visit us at hopebridge.com.